Aloha! This CME activity is jointly provided by the Queens Medical Center and UH-JABSOM Department of Geriatric Medicine. We offer free continuing education for this series. In order to receive a CME or CEU, participants must complete the online evaluation at the end of the webinar. Your comments are very important to the planning committee and will be used to plan future programs. ECHO. About ECHO, we want to remind everyone that this is an ECHO webinar, which means that this session serves as a forum for mutual teaching and learning from experts and from each of us on the front lines. As the ECHO motto goes, all teach, all learn. So it will take all of you to create this community of learning. In the spirit of Aloha, we encourage you to turn on your cameras to help us build a community of learning. Feel free to eat during this ECHO session. Good nutrition is key to a healthy lifestyle. A little bit about our format. After a short lecture from our experts, we will share expertise from the rest of the team and then open the time up for case discussions. We invite you to share any geriatric cases. It may even be on a topic not related to the topic of today's lecture. We only ask that you keep it HIPAA compliant case for discussion. That means please do not share patient's name, birthday, address, and so on. We learn best from our patients. They are the best teachers. Our interdisciplinary team is here as well, and we are all willing to teach and share our collective wisdom with you. Most of you already know me. I am Juanette Gaylord, President of Alliance of Residential Care Administrators, ARCA. We have Maribel Tan, President of Foster Family Home Association, Elsa Talavera, President and CEO of All Island Case Management Corporation, Brittany Pacheco, Health Coordination Manager for Big Island and Kauai, and LTSS Coordinator from Aloha Care. Leila Ventar, Health Coordination Manager from United Healthcare, Kauai County, and Dr. Rita Bell Fernandez from the University of Hawaii. We are in our third month of our mentation series. If you're interested in viewing any of those lectures and handouts, you can find them on our website. Unfortunately, we cannot offer certificates of attendance for videos you have viewed. You must participate in our education live. The title of today's webinar is Medicare, Healthcare, Scams, and You. Now, it gives me great pleasure to introduce our distinguished speaker, Norma Kopp. Norma Kopp is a program specialist with the Hawaii Department of Health, Executive Office on Aging. She served as Senior Medicare Patrol, Hawaii Volunteer Coordinator from December 2019 before being named director in February 2021. Norma brings her work experience in healthcare administration, post-secondary education and marketing, communications to advance S&P Hawaii's mission of assisting and empowering beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. Norma's personal experience with community care foster homes is based on several years with her mother, who lived in a licensed residence in Whitmore. Norma describes it as a consistently positive and encouraging experience with open communication, respect, and dignity, all with a safety-first attitude to everything. Norma's parents were foster care parents for nearly 12 consecutive years. We now welcome Norma Kopp. Thank you.
Aloha and mahalo on that, and everyone who helped coordinate this special session today. I understand I have about 20 something minutes, and it's sort of like a TED Talk format. So again, thank you for this opportunity. And on behalf of the Department of Health, Executive Office on Aging, which is the state's lead designated agency on everything aging, supports and services through our counties, mahalo again for this opportunity. I want all of us to take a deep breath and really think about where we are. We are physically here in this incredible, fragile, unique, and precious land called Hawaii. Some of us are migrant children, some of us, like me, first generation, um, such freedom and liberties, and thinking about how neighborly people are generally speaking. And with the Aloha spirit, uh, when we properly understand it, it can be a major force for goodwill and welcoming, not just the people that we know, but others, right? Other cultures, other diversities, and making sure that each person matters. So, in your incredible calling as caregivers in various settings, think about the incredible privilege you have of being always mindful of our residents and the people we take care of. That's safety first. And I love what I learned yesterday at one of our sessions with caregivers, and the saying from Dr. Kevin Kawamoto. I don't think he coined it, but he shared it. And it was, rushing is the enemy of safety and serenity. So today, let's just immerse ourselves in this, not think about our to-do list, not rush, but just take a deep breath and take this all in. When we think about money, we think about how precious that is, right? That's an asset. Thank you, John. It's an asset that we don't take for granted. It's hard earned for many of us, and it's something we want to protect. And that takes years to earn, right? And invest and find some ways to get our biggest bang for our buck. And when you think about generational wealth or even just monies that are given to us, we also want to protect that as well for many generations to come. But in various ways and in so quick of a time, all of that can be destroyed. And so today I want to personalize this about Medicare, about this health plan that we have that we pay into the minute we work, and that it's really a personal journey, that we protect it for not just ourselves when we retire, but also for those that follow us. So this presentation is made possible through our federal grant from the United States Administration for Community Living, ACL, which is supporting 54 chapters of SMPs nationwide. It's a volunteer program, federally funded. And here in Hawaii, our Luna, our boss, our supervisor, our manager is the State Department of Health, specifically the Executive Office on Aging. So without further ado, let's go ahead and start the slide here. Our mission is really, when you think about what is SMP, SMP is the acronym for Senior Medicare Patrol, not medical, but Senior Medicare Patrol. And we're here through education. It can fire us up. It can empower us. It can help others. And the more that we share what we learned today, it'll help retention, right? It'll help us. And so beneficiaries, family members, caregivers like yourself, our whole mission is to PDR. What is that? It's to prevent, detect, and report anything that we find suspect with regard to Medicare fraud, billing errors, some unintentional, but sometimes it's not, it's intentional, and abuse related to Medicare. It's a big business. We have on report $60 billion lost to fraudulent claims just through this health plan. Imagine $60 billion. That's just reported claims. Can you imagine those that don't report because they're just too ashamed, too embarrassed, too scared? To tell even their loved ones or their adult baby Zoomer children or their mo'opuna, their grandchildren, that they've been scammed. So we're here to help. And we do this by working with other agencies. Some of these people I'm seeing that are familiar, we work with them. We have Hawaii SHIP, which is Medicare counseling, the long-term care ombudsman program. These are sister programs of ours. We have various agencies that we work with. We'll get into that in just a moment. We have here in Hawaii 50 volunteers statewide that are active. And what do they do? What's a fraud squad member do here? Well, they go out in presentations. They train other volunteers. They counsel on the phone. Sometimes we do it on Zoom. And then there's all people who exhibit. They go to health events and they share their mana'o, their information. We have people right now in our office, doing packets, right? They're doing inventory. They're doing Excel spreadsheets. They're doing behind the scenes. There's plenty of work to do when it comes to fraud. And we are here to educate people. So if you were to look at our business, it really is about healthcare fraud prevention education. Okay, so fraud prevention education by way of Medicare. Next slide, please. How big is this problem? Is there one prior to this, John? How severe is this problem? Yeah, thank you. So imagine since Sunday, right? As we got wrapped up from the weekend, getting ready for work, right? Sunday to today, 50,000 Americans are eligible just in these last 5 days. 50,000 Americans turn 65 and they become eligible for Medicare. Some of us in the 12 million count are dual beneficiaries, Medicare and Medicaid. If you look at Hawaii, we lead the nation on average life expectancy, about 80, almost 80, 81 years old. We lead the nation, people. Puerto Rico, Guam, District of Columbia, the US Virgin Islands, they don't even come close. So, when you think about it, scammers, they got a lot of years to work us. 80.7 years, right? So think about our nanas, our tatas, our lilos, our apos, everybody around us, all the people that we know that are 60, 65 years or older. And you think about cognition, dementia, all of these play into just being a green field for fraud. So in 6 years, people, our kupuna, our older adults are going to make up 1/3 of our state population, 1/3. The liliha pie cut into 3 pieces, 1/3. And in double that time, in about 12, 13 years, our older population will be 500,000 qualified for Medicare. So Medicare has a solvency issue, right? You think about the scammers, $60 billion a year reported claims. It's probably close to 6, 70, 80,000 $1 billion. But we don't know that because a lot of people are too ashamed to call to report it. Next slide, please. Thank you, John. So who's affected? Is anybody immune? No, not even your 6-year-old great-grandchild, right? Not even your 12-year-old or 21-year-old student, niece, daughter, because they're all heading towards Medicare, right? So as the sun rises, we're a day older. So think about this. As you look at this slide, everyone is affected. I don't care how old you are. You look at Medicare impairments, implements cost containment measures. You look at the premiums coming up, right? So in 2021, we had about $148 premium, monthly premium. Now it's projected to be about $185. There's low coverage for eligible services. There's changes in eligibility rules, higher penalties when you're not enrolled or, for late enrollment for a lifetime. You look at doctors exiting Hawaii, not just on the Big Island, but elsewhere. You look at people on Maui with the Maui wildfires and the aftermath of all that, higher patient count per doctor, lower health outcomes in Hawaii. There's a lot that's just gripping health plans like Medicare. So think about it. It's not just kupuna, it's all of us that's affected, right? Next slide, please. So let's look at how we define fraud in healthcare versus abuse. So let's look at the left side. Medicare fraud is when it's intentionally done, right? They're attempting to execute a scam of some sort to really cheat the Medicare program by submitting fraudulent claims. It could be obtaining information, crookedly, right? By deception. But criminal intent is involved in this. So when you think about criminals, we think about fraud. Now, on the abuse side, it could be like once in a while, episodic, one shot in the dark, or it could be a series. But this is where providers supply or they bill services that you did not need. And many kupuna, they're not even looking at their statements. They're just paying the bill, right? We have episodes where people call in and say, oh, I think my grandfather mistakenly paid a bill that he shouldn't have. So it's things that people don't need. They didn't agree with the doctor. They didn't even talk about it with the doctor, and yet they're getting billed for that. So that's called abuse. So abuse can lead to fraud, right? So they kind of overlap. All right, next slide, please. What are some common types of Medicare fraud, right? What are they? I mean, under the guise of like imposter scams or online scams, if you were to chop up the types that are common Medicare, they are ambulance, COVID-19, even today, we have scams related to this pandemic. Durable medical equipment or DME, genetic testing, home health care, hospice, medical ID, right? Everybody who's an imposter wants to be you online. If they can get maybe your social security, last four digits, or your date of birth, they can go to town, right? They already know where we live. Google yourself. If you have property, Google your property. Type in your property address. Go to Google Maps. You'll see your backyard with your, I don't know, Rottweiler in the back, right? They can see we're all online. Medicare marketing violations, nursing homes, caregiving scams, outpatient Medicare healthcare, pharmacy and prescription drug. And healthcare professionals are not sacred, right? Some of these people are hooked on opioids. They're taking home the flask, their water bottle flask with stuff in it. And some of them, we have reports where they're selling the drugs. And these are people that are licensed by their states as medical professionals, willing to take that risk. Why? Not just for the money, right? Not for the kickback, but for the control, the power, the personal identity that they're going to steal from us. And if they take from us, they're going to take from our kids. They're going to see the tree, the family tree, right? They're going to look at obituaries. They're going to figure out, okay, who's the grandson? There's just so much available for scammers to get so innovative. And then you toss in artificial intelligence and technology, and it's a circus. So we got to be not just diligent, but vigilant, protecting ourselves, but especially the people that we care for, who are most vulnerable, right? Next slide, please. Look at the pandemic. We're going to just focus in on three because we could go on and I only have a few minutes. But the pandemic, people think, oh, it's done. 2021, 22, the mayors all gave us the green light to go back in the community. No big deal. Public health emergency, all done. No, it's not done. We still have to be vigilant because what fraudsters want to do is they want to get the identity, the indicators that make us them or them make us. I mean, that they're going to be us. They're going to morph into us online. Then they can open up 10 credit cards, right? And then go to town with, I don't know, Nordstrom, you name it, right? Expensive, Rodeo Drive stores, whatever. Amazon, right? Amazon's getting hit with scams. So take a look at this because this is not going away. We're going from a pandemic to an endemic. And so we want to make sure that people are not giving away their Medicare numbers, right? Simply like this. Someone calls and says, oh, Mr. Kunimoto, so we see that you're going to have an appointment this week with your doctor. So generic, right? Obviously, which older adult doesn't have an appointment with a doctor this week? Oh, yeah, I do. Okay, so Mr. Kunimoto, so you don't have to wait too long in the lobby, here at the doctor's office. Can we just double check your ID number, your social, your Medicare number? Can we have it again? So that way you don't have to wait. And guess what? Mr. Kunimoto coughs up his number because of the word again. Simple words like that. So we teach our volunteers what to listen for. Again, makes people think, oh, okay, you have it already, but you just want to remind me so I don't have to wait in the lobby. So we have to be careful about things like that. Scammers don't have to think too hard to get us in their trappings. Here's a situation where it really happened. This is a human error, what we discovered, but at first it was suspect. So let's take the next slide here and look at this. A Hilo man received a bill this summer, and it was, if you can see, just sort of the notes here. It came from, he's a Hilo man, a man from Hilo now. He got a bill from Oahu for COVID-19 drive-through several years ago, 2021, around that time. And he got charged for 2 outpatient visits related to that. Now, what he did was he needed help, believe it or not, with opening his mail. He was overwhelmed. So he went to one of our county agencies on aging, right? It's called Hawaii County on Aging on Kinoole Street. And he asked the staff, can you help me? I need help opening my mail. Look at all this. There's a bag of mail, right? So they did. They tried to help him. And there's a bill that came across. And the staff called me and said, I think this is fishy. Like, why does Uncle have to pay $415? Anyway, long story short, we got a hold of the company, the doctor's office, and they said sorry, they made a mistake. This was not something to be charged to the person. But had the person not reached out and asked the county office on aging for help to open his mouth, had he been too proud, had he been so like, I don't like bother, I don't like bother, I don't want to bother. Oh, don't bother the neighbors. He would have probably just paid the $415. Now imagine to you, maybe $400, nothing, right? But times that exponentially by so many bills that go out unintentionally wrong that people just pay. And so this is a good example of a partner agency working with us. I'm calling the doctor's office asking for an explanation, and then the person says, oh, you know what, we made a mistake, sorry, we're going to send a zero balance, a bill that says no need to pay. So this is a great thing to know, is that S&P is here to help you, right? If you don't know how to read your Medicare summary notice or your eligibility or explanation of benefits, if you have Medicare Advantage, we are here to help you. And that's what, we say prevent, which is education, detect, which is understanding your statements, and then report, calling us so we can work with the partner agencies to try and get your money back. Speaking of money back, look at the next slide. So before we go into another case, when people are socially isolated, especially the lockdown during the pandemic, and they do not want to bother people or expand their support team, or you yourself, oh, no bother, they're busy, like bother. You know what happens? People get duped, people get victimized, people get trapped, right? And then when they get trapped, what's worse? They don't tell anybody because they're too ashamed. Think about romance scams or friendship scams where they think they're getting a new boyfriend online and they think they're helping. He's going to be a new doctor in Korea. Oh, this is an actual case. An 89-year-old widow gave $50,000. A couple months later, $80,000, trying to help him, right? In Seoul, Korea. That's her new boyfriend. And then one more for her, $130,000, $260,000 of her money. And there was no boyfriend. There was no return call. No text, no nothing. She was so ashamed. Then you think, oh my goodness, the next step with kupuna, suicidal tendencies, right? So these social determinants of health need to really be looked at, right? Because when we are Department of Health, we're not just looking at medical health or dental health. We're looking at emotional, physical, financial, spiritual, all of these types of health. Right. So that's why we say, even though we don't take care of our mission is more healthcare, but we will pay attention to helping people with romance scams, cryptocurrency, Amazon brushing scams. We will work with those agencies, right? That's our secondary thrust. But we trust our partners to do their job as they appreciate us staying on our side of the fence with Medicare fraud. So don't be ashamed. Use us. That's why we're here. And it's all free. So speaking of which, next line, a couple emailed us and said, we need help. And basically what happened was she agreed and not coherently to a charge for her dental work. But when she came to, the dentist charged her $10,000. And we got wind of it because of this lengthy email. A couple was very embarrassed, but they got through their pride and swallowed everything and explained it to me. And then I called them to get more information. Bottom line, we called Commerce and Consumer Affairs. You can see their logo there. Worked with the investigators, and lo and behold, dentist had to cough back a $10,000 refund. And Yelp is just blasting with reviews, right? I'm not going to tell you the dentist's name, but this is an example of S&P going to work on behalf of something that is terrible, right? Signing off on something on a patient who can not quite understanding the situation, but yeah, she did sign, but the investigator said this is not right and the reasons why. And so the dentist said, okay, so cough back $10,000. But you can see our partners, right? Attorney General, Better Business, Federal Trade, Internet Crime. These are people that I actually work with, right? Matcha, the CEO, all of the lead banks here in Hawaii I work with. We all work with them. And it's a tight-knit group, law enforcement group, right? So timing is everything. That's why we don't have room for arrogance or pride, right? Just call us, swallow the pride. Don't worry about losing face. Just call us so that we can get to work. We can't promise the world, but we can do our best if you understand the importance of timing. Next slide, please. Another fraud is DME, where you get a brace or a wheelchair or something to help in terms of durable medical equipment, but you didn't agree to it. So these slides are for anyone who would like to have them. So I'm not going to go through all of these, but be careful of the word free or discount. Anytime they're asking you for your Medicare card number, no, hang up, right? There'll be more people coming to your door, so be careful. It's not just text or email, but some people might surprise us at our door, so be really careful. This is more common, the in-person interface. It's more common on the US continent than here in Hawaii. Next slide, please. There's certain things Medicare will cover, but certainly a lot of the things that scammers do makes us rush. That's why I said, rushing is the enemy of serenity and safety. Scammers are good at rushing you. It's called putting you under the ether, ETHER, right? The psychology of fraud is either rushing you, threatening you, working your glory, making you feel good, or making you feel like you're so special. These are all these emotions that they play. So be careful. We just put the codes here so you guys can see types of DME orders here. Next slide, please. Medical ID is yet another type of scam. This covers a lot of different areas. So, when we were kindergarten or even toddler, we learned how to spell our name, right? We never misspell it. We never spell it wrong. Our name, our last name. But when we give out information, it's almost like we're misspelling our name, our father's name, our maiden name, our first name, because now the fraudsters are going to town with your name, right? They're making sure they're going to get everything under the sun using your name, your identification, your personalized numbers because you gave it away by mistake. Of course. You didn't mean to, but you did. So especially with our older parents, our relatives, we want to be mindful, take the time, not scold them, but teach them, share this information with them. Types of examples would be medical treatment, medical equipment, prescription drugs, even surgery, believe it or not. So I'm not going to go through every line, but understand, just hang up, delete, permanently delete. Don't answer the text, report it, give it to us, like tell us, right? Call us, take a snapshot, send it to us. We have an email. Next slide, please. Be careful of the 808s. That doesn't mean you know them. If people care about you, they'll leave a voicemail, right? You know who's in your contact. So 808, scam likely. Okay, great. But what if it doesn't say scam likely? Are you going to answer it? Especially if you don't know 808, No, nothing is so rushed. Nothing is so urgent. Nothing is so invaluable and priceless that it cannot wait unless it's one of your loved ones with an emergency. So be careful. Never give out your numbers. I don't care what it is, Medicare, Social Security, none of that, right? Your clinicians, your healthcare team, your residents' healthcare teams, they already have your Medicare information. They scanned it the moment you guys met up with them in their initial consult. Remember, they have it. I used to work in clinics. We all have it. We don't have to ask for them. Okay, so again, we're going to go back to our mission, prevent, detect, and report. So let's go to the next one as we wrap up. Prevent. Everybody say it silently, is the same as education, right? Prevent. Families, households, friends, calabash, the more we talk about scams, characteristically, that household ends up being less scammed. Think about it. If you're not talking about something and you get hit with a scam, you're easy prey. But if you talk about it and put it part as your vocabulary, like brushing teeth or combing your hair, make it part of everyday discussion, or every other day, but keep it mindful for front and center, you'll be less likely to be trapped by something that looks too good to be true. Next slide. Detect, scratch and sniff, smell it. Is it? What, I don't know. Everything looks real. Is it real or Memorex, right? AI makes its artificial intelligence makes the thing look so real. So we have a tracker here. It's like a checkbook. You write down all the appointments, you write down your medication list. Who knows? You might fall. Resident might fall, cannot talk. The medical tracker, Medicare tracker, you can actually find it. There's your information. At least it's helpful, right? Not everybody knows how to do the iPhone notes application, but you can write it in. And it's so good for cognition. We're doing Wordle, we're doing New York Times puzzles. Tracker is a great thing to have for cognition. As we get older, we tend to lose some of that memory skill, right? So let's use the tracker. It's free. You can have it. Just let us know you want it. Report is the last thing. So PDR, prevent, detect, and report. Call us. Don't wait. You want to call your provider first, your physician. If you're still not happy, something, I don't know, one cup of kai or whatever, you can call your health plan, HMSA, whatever plan you have, Ohana, and still not satisfied, give us a call. But be ready because we're going to ask you for documentation, right? The best kinds of calls we get, like the one couple that got back their 10 grand, was they were able to tell me who, the what, the when, the where, the why they think, reason why, and how. So who, the dentist's name. What, we did not fully understand this $10,000 agreement. We certainly don't need it, right? When, the date of the procedure. Where, I won't say where, but I'll make something up, Palolo, okay? How, physical, in person at the dental office. Why, maybe the dentist wants more money. We don't know, but we feel like we've been deceived. And then how, again, in person. So who, what, where, when, why. And when I got that, I was able to run with it, got to the Commerce and Consumer Affairs branch chief and talked to the investigator. They assigned an investigator. In a matter of 2-3 weeks, they got their money back. So again, we're not promising anything, but if you do your part, you see this as shared Ohana Kuleana, like this is a shared thing. This is not for you to sit back and go, oh, okay, Norma going to do all the work now. No, it's a team effort. So call us for this tracker, call us for presentations. We can do a Zoom with your family at night, whatever, we can do presentations at your clinic or your setting or wherever you are. Next slide, please. We are a volunteer program. I think we got this one already to report. And then the next one would be about our volunteer program. Again, none of those people you see there are paid. They're all non-paid. They do it because they love you and they love Hawaii and they want to keep Hawaii as best as it can be, right? So staff and volunteers are here. Knowledge is power. Education is incredible. Share this so that you can keep it up here and down in your heart, that it becomes part of you and it becomes a part of your discussion. Some of the best families in terms of prevention education I work with is they make this discussion a regular conversation with their loved ones, their children, their grandchildren, right? How many of us talk about estate planning with our kids? How many of us sit together and meet with the attorney about living will and trust? Why not? They're affected. If you make the families become familiar with these terms, there's less mystery about it, right? So you might have different opinions about that, but I'm an advocate for education, and that includes my own 3 children. The more that they know, they don't need to know all our financial situation, but they need to know the principles. Then when they go out in the world, they can embrace these terms with less like, oh, what is this about? Right? So they know about these frauds and scams and they're more mindful, especially when 18 to 24, ages 18 to 24 is the #1 age group that get caught in online purchase scams. Why? Because they're so easy and nimble with their iPhones, right? Their Androids, they're so good at purchasing stuff. So the 18 to 24 years old, they're the #1 scam group in the nation, to lose so much money on online purchases because there are so many different fraud and scams for purchases. Next slide, please. So again, thank you for allowing us the time on behalf of the Executive Office on Aging, an attached agency of the Department of Health. We are S&P Hawaii. Our sister programs are SHIP with Medicare counseling and long-term care ombudsman to help people maintain their dignity and respect in licensed settings. And so we just want to mahalo you and thank you for the time that you've given us.
Thank you, Norma. Does anybody have any questions? Norma, do you guys have an email address as well that you can share?
Yeah, it's on the slide, but let me go ahead and tell you the information, education, any kind of requests for groups, presentations, or join us at an event, or you want to take us on the road for health community events. It is info, I-N-F-O, the @ symbol, smphawaii.org. So just remember org, and that's easy for people to remember our website as well, right? So again, email is info, the @ symbol, smphawaii.org. Our website is smphawaii.org. And we try to promote all of the different caregiving sessions as well. So thank you for that question. Thanks, Doctor. Chatting it in, perfect. But it's all on our slides, and you guys, if you want, you folks, the planners here have this. I don't mind sharing this PowerPoint with everybody here. The more people know, the better. Awesome. Thank you, Brittany.
Anybody have anything they want to share or
Yeah.
ask Norma while we have her on?
Everybody thinking the holidays and getting that turkey at Costco or wherever. You're thinking about, okay, where did I leave my credit card? Did I leave it at the register? I mean, there's so many things to think about. Don't rush. Remember, rushing is the enemy of safety and serenity. Think about all that's coming up, unfolding for you this week and next week. Just take a deep breath, look at this stuff, and be mindful and proactive, and you'll be as good as gold, because it's one step closer to PDR, preventing, detecting, and reporting.
Hi,
And
I
it's
have
the
a
holiday.
question.
Go ahead.
Can somebody hear me? Doctor, what do you think about these programs like ID Shield, where you can put in your information and they're willing to detect if anybody tries to use your medical card or anything like that? Are there any of those programs something that you would recommend for people to use?
We're a doctor, so I wasn't sure if you were talking to somebody. I'm not an MD, or a PhD person, but as long as I've been in this business, I've never had to resort to that. But I do always, every morning, check all our financial institution accounts. Always. That's part of our, like I said, brushing my teeth or fixing the bed. Religiously check and monitor all my credit card, or federal credit unions, all of the banks that we have accounts with every day.
Wow.
I don't miss a date.
That's amazing. I mean, that's definitely something I never really do, because sometimes, like a month would go by or 2 months where I'd never get on to check my accounts, but thank you.
Yeah. One more thing on that though, because we work with the top security people that report only to the CEO of their respective banks. They all tell me the same thing: Bank of Hawaii, American Savings, and First Wine. If any of you, and this is going beyond Medicare, but it is related to Medicare. Why? Because once they pounce on you financially, you're going to end up sick, and then you got to bust out your Medicare card, or, use your Medicare plan. So it's all related to Medicare. We always say it to ourselves. But if anybody should get scammed, the first thing is, aside from, the police, you gotta call police, because they'll put a claim number right next to your situation, and that just report it, right? Like you would do FTC, report it. Don't feel like it's never going to go anywhere. Yes, it will, right? The other thing is, go to the branch you work with. So if you live in the, Pu'unui area, or I know some of you are on Neighbor Island, but if you're in the Liliha area and you bank at Liliha, whatever, Bank of Hawaii, go to that branch, right? Go in person right away and get the bank manager there, like talk to them. The idea is that there's that physical interaction, not the phone call. Because when you go calling the banks, they got all the stuff, the menus, and for anybody, that can be really annoying, especially when you're under a lot of pressure to recoup your money. Always get in the car, get somebody to take you, hence the support team again, right? Get someone to take you to the branch that you normally do your transactions with. Big big advice. Yeah. Physically get there right away.
Can
Don't
can I
delay.
ask another question, please?
Sure.
Has it ever been an issue, like if someone is using your card, your Medicare card, and you don't realize it, have they ever denied the person that actually needs the care when you finally go and like
Yes.
say
The
they do?
worst case I have, because I work with all the S&P. So S&P California, the number one fraud in the state of California, from all the way up Redding, all the way down to Mexico, right? San Diego, is hospice. So great question. If you are one of those victims where the scammer has put in a claim for hospice, any kind of service related to terminal illness, and then when you need it, right, and it's your card, you're going to be denied eligibility. You're not going to be able to get that service because it's been exhausted, right, for that particular ICD code, whatever it might be. So that's why I'm talking about the solvency issue, like a checkbook that's weak with very little funding. Medicare, treat it like that. Treat it like it's a weak checkbook and it's your part. So all our volunteers feel like they're integrity defenders of Medicare. They want to defend Medicare for generations to come. That's why they volunteer. They're not doing it because they get paid, because they don't get paid. But great question. The answer is generally, yes, you will be denied.
So
Yes.
how would say I was, somebody took care every day, like how you would check your bank accounts? How are we able to check to see if any insurance fraud is taking place with our card?
Medicare.gov, if you go and set up your online, it's good. I mean, I have our volunteers use it. So they set up their online virtual account. And again, here we go with username and passwords, right? So be diligent about that. Don't lay it around for everybody to see. But once they get their online account set up with Medicare, it's on demand. You can check, just like my financials, right? I can check to see any hiccups or suspicious activity. But it's also good when you do need to talk to Medicare. Let's say in general, you get a counseling with Hawaii Ship and you want to follow up Medicare. Get to know the agents, right? What's your name, Sally? Hi, Sally. I'm Norma from, Oahu, from Honolulu. I mean, get just like the banks. Get to know the tellers, like your physician, your primary care, even for your residents. Get to know the MAs. Get to know the interns there. Get to know their names, right? Because when they send us, Kunimura, so you don't have to wait too long. What was your Medicare card number again? Who is this? Charlie? I don't know any Charlie. You work for Dr. Sakamoto. Hang up, right? Or don't even engage, just hang up. Getting to know the people that you put your trust in for your health, for your banking, for your Amazon purchases. I mean, I'm writing down their names. There's just certain lifestyle habits I've created because people with more wisdom than me have told me, you better, or you shoulda, woulda, coulda. I don't want to live a shoulda, woulda, coulda life. I want to live a life that's wise and smart. So I hope that answers your question.
Yes, that was perfect because,
On demand.
yeah.
You have the explanation of benefits for the Medicare Advantage side. Yeah, on the original Medicare, you have the Medicare summary notices that come 90 days in the snail mail. But if you don't want to wait 90 days, you want to wait every day. You don't want to wait. You can set up your account online and just get the activity as it happens. Then you can catch it and give us a call if you go, hey, I don't think I was billed correctly. And then you think about the people that put their trust in you, the residents you guys care for. If treating them as family, as if this is your marrow, your heart, the way inside your bone, you're going to want to, whatever's that you're doing for them, you're ingraining it for yourself as well. It becomes part of your DNA after a while. Like, oh, I'm glad I did it for uncle because this is happening to my nephew or whomever, yeah, or me. Great question. Anybody else? I'm always a phone call or text away. Well, I can give you my cell number, but I'm always available. I don't want to say 24/7 because we got to sleep, but scams know no season. They know no time. They know no month. Scams are 24/7.
You mentioned you're willing to give presentations. Like if I had a group of elderly people in my church that, am I going to be able to use your PowerPoint, or are you willing to come and do a presentation depending
Of
on how?
course. Yeah, in our for those of you interested in volunteering, we have a portal behind the website, the intranet called Volunteer Team Portal. We put our calendar of events there, and it's color, all different colors, and it tells us who's who's going to present on what topic, etc. So yesterday we had Hawaiian Electric online. We had like 170 people, the employees, and many of them are caregivers. So and then we're at churches, we're at the state credit unions, we're all over the place, and we're statewide.
Wonderful. Thank you.
You're very welcome.
Norma, I have a question. Thank you for the great presentation, by the way. So the issue is like my friend's parent, right? Like she has a lot of like savings, however, it's getting depleted and they can't prove on where it's going legitly. How, like, where do you start? And it's like depleted like hundreds of thousands of dollars. Where would you start in a situation like that, where your mother is still with it?
Where are the statements? Where are the online? Where is the statements? Where are the accounts? I mean, is there a power of attorney? I mean, there's all these other questions, right? So one of the things that makes for successful communication, right? This is the learning part, is framing the discussion, right? Making sure the frame is just so. So things like, okay, first of all, cognitively, is she aware? Because obviously it doesn't sound like it. I don't know. Who is there a power of attorney? Where are the latest bank statements? Depletion, what do you mean? Like, there's so many unanswered questions here, but you're giving me a scenario, but that's how it would start to roll out if people were to call us, right? And he said, she said doesn't work. It just makes matters worse, right? So that's why when you're talking to someone who's like victimized, or they're under the ether and they're just like ignoring you because they're under the ether, you got to tell them like, stop, or I'm gonna have to call police, right? But that we're not just gonna take like just a call. We're gonna be asking you guys questions: who, what, where, when, why, how. And again, we're not Mannix, we're not Steve McGarrett, we're Medicare fraudsters. We're trying to like stop this so that we can keep the health plan going. But for non-healthcare related, we're going to turn that over to the agencies we work with.
Okay, that's helpful. Thank you.
You're very welcome. So every year we have 365 new resources or not. Every day we have 365, every year we have 365 new people that we know, right? Every day we have this incredible opportunity to come up with a resource. Go find a resource, go make a friend. Like I said in the beginning, everybody matters. Somebody has resources, right? And how to use them. For our counseling team, they're trained every time. And we go through role-playing, case sharing, and we have a bunch of resources they can use, but to use them properly. So we don't burn bridges, right? Or we keep that relationship. I got to tell you though, I think you've heard it many times. It's all about the relationship. So if you have a healthy relationship with the people that trust you, you have the people around you, you're expanding your support team, you're leaning on Juanette, you're leaning on Dr. Fernandez, you're leaning on these agencies, and you're also reciprocating and giving them benefits that you have, it makes for a great relationship. And next year, 365 days later, you're that much more powerful. Anything else?
This is such a great presentation. I do have to tell you, it's very stress producing. Like it makes you worry, like, before I listen to it, but it's real, it's happening, but it's really scary.
Yeah, I mean, when you're hearing it for the first time like this, perhaps, but breathe in, breathe out, and realize that if you didn't have this information, where would you be mentally, emotionally, right? My children, my husband, my immediate family, the pupil of my eye, anybody comes close, it's like touching my eyeball. So it's on me. I have a greater fall if I become victimized. And let me tell you, it's not easy. The people on our fraud squad, they're not immune to it.
Right.
And this is the thing. It's like a magnet on the refrigerator. You don't notice the magnet until it happens. Oh, I got to call them, right? You don't notice anything that I'm talking about until you or a loved one, like touching my eyeball, becomes a victim. That's why all this might be going over in your head right now. It's maybe, but Think about it. If you didn't have this information, you didn't have this PowerPoint, you didn't have the phone numbers, you didn't know that we have so many agents around the nation, you wouldn't be as empowered. And here's the deal about partnerships. It's one thing early on in your career to say, oh, I know this guy, I know that, oh, I know that, oh yeah, oh yeah, oh yeah, I know them. But somewhere in the trajectory of a successful career, things happen for you because they know you. So think about it. S&P knows a lot of people, knows a lot of partners, but do they know us? And I can tell you, when I make a call to an agency, within 12 hours, on average within 6 hours, most times it's within 2 hours, I get a call back. I get an email reply. And that tells me they trust us. We're not wasting their time. We need help. That is one of the manifestations of a good partnership, is not just that you know people, but they know you enough to respect you and get back to you right away because there's something brewing. And together we're just better.
You know, I'll give my own 2 cents because it did happen to my mom. So somebody called, fraud call, said there was something wrong with my brother. And the whole thing is she went to Bank of Hawaii, she took out the money, she was actually en route. It was only a blessing that I called her and I said, hey mom, where are you? Blah, 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 blah. And then she's like, oh, you know what? I have to tell you that. I said, no, stop. Where are you?
Yeah.
So I said, no. And yeah, so I was blessed. The timing was perfect and I was able to intervene.
Yes. See, timing is important, right? But start today, start tonight, and just simple, like, over dinner. We're lucky to have a table and a roof over our head. A lot of us don't have that in Hawaii, right? That's why I'm saying I started off my conversation with you guys. Like, this is an incredible gift we have, what we're doing right now, right? Getting together like this. But start tonight and just put something in people's ears. Like, hey, I just heard this discussion and I got the PowerPoint, but I want you guys to read it. I'm going to put it by the phone. I'm going to put it on the counter. I want you guys to go through it. You don't have to read everything, but go through this because this is incredible, right? So real quick, another case that came up, a woman called, texted or emailed and said that she had lost $210,000. Long story short, it wasn't 210. She was too embarrassed to say the amount. It was actually $480,000 she lost to an employment opportunity that ran 2 months. And she realized it was a scam only after about the 9th week when nobody started calling back email, texting back. It was all on text. So that's a giveaway, guys. If it's text, right? So it seemed like a pyramid scheme. She's a business owner. And so there's the guilt, right? I should have known. And I was at the cusp of working with a CEO for a company called Matcha. I talked to the CEO and I said, can you help? She goes, yeah, we can help. Just for maybe get some online payments back to her, get the information. So I go back and the woman says, I don't want to talk anymore. I've given up any hope. So I have the extreme cases of that profile of, I don't want to talk. I know you're trying to help, but it's just so depressing. To, they're going to go rogue. They don't want our help. They're going to go rogue. They're going to figure it out. They're going to meet the guy at the airport. There's no guy, guys. It's multinational. It's multi-countries. The money is moving so fast, from, I don't know, Wailua, Haleiwa to Papakolea to Maui to Russia to China to you name it, right? The money's moving so fast. And then I have the bulk of the people that say, thank you so much for your help. Thank you.
Norma, if somebody wanted to get a copy of that healthcare tracker you shared, can they just call or email you?
Yes.
Or email S&P?
On our website too, we make it easy. You can go to our website, info@smphawaii.org, and there's like the portal where you can order whatever you want, brochures, tracker, or just email us, info@smphawaii.org. Or if you want to call my number, if you're not comfortable, just everybody who's planning this knows my number. So they can just ask for how many trackers you want. Some of it's in Olelo, different languages. We have 7 languages for the tracker: Chinese simple, traditional, Ilocano, Tagalog, Korean, Vietnamese, Japanese.
Nice. Thank you, Norma.
You're welcome.
Thank you for that presentation.
My pleasure. Go get them, guys. PDR. Thank you for Dr. Fernandez, everybody, for inviting us to be part of this. This is really important.
Very.
Well, we
Thank
appreciate you, Norma. Of course, you always do a wonderful presentation. We'd like to go over the questions as far as mentation, dementia, and depression. I'm not sure, Layla, were you going to take care of that, or did you want me to do it?
You can go ahead and cover that when that.
Okay.
Since you're
So thank you. So basically, we want to know how many of your residents have been screened for dementia or memory problems in the last year. So that's the first question. And then how many of your residents have been screened for depression in the last year? How many of your residents had an emergency room visit? Let's see, hospitalized because of agitation or delirium in the last year. So those are the only questions that I see. Layla, are there more?
I believe that's it, but I can go ahead and continue this part, Winnet. Thank you so much. So just a reminder for everyone that in order for you to receive your certificate of attendance, please make sure that you complete the evaluation, and we have your correct email address. So one certificate per individual. So if you are attending this meeting as a group, in a group, you still need to register everyone to get their individual certificate. And for those nurses, fellow nurses, or licensed personnel, if you want CEUs, it will be you still need to complete the evaluation, and the certificate will be emailed to you at the ending of the year.
Thank you so much.
So much.
We appreciate, of course, the Hub team working together. Thank you, Dr. Fernandez, in leading us always. Appreciate everybody's input. We wish everybody a happy Thanksgiving, and obviously we're looking towards Christmas, about a month away. So everybody be safe, take care, and aloha.
Aloha.
Aloha, everybody. Thank you. Happy Thanksgiving.